po na umaga po sa lahat ng nakasubaybay ngayon sa ating video forum Zoom meeting, DOH Facebook at YouTube page sa anong kahagi ng ating bansa. Ang inyong pong lingkod mula sa Department of Health. Ako po si Linda Garcia and I will be your moderator for this morning's media forum. But before we officially start our press conference, allow me to acknowledge our panelists in front who is joining us today. Jose P. Lican, Memorial General Hospital Medical Center Chief Dr. Monserrat Chichocro, 4th District of Pampanga Representative Honorable Ana York Bonag Sagrum, and of course, Pampanga Vice Governor Honorable Ilia Pineda. Muli isang malusog na umaga po sa ating lahat. It is through this media forum that we aim to address the questions of our kababayans through our friends from the media on the importance of Bukas Center and the plan of the Department of Health to establish not just one, but 28 bagong urgent care and ambulatory service or Bukas Centers by 2028, aiming to bring quality primary care services within the reach of 28 million Filipinos or simply 2028 by 2028. To officially open our media forum, may I call on Department of Health Secretary Teodoro Herbosa for his opening remarks.
Thank you very much. On behalf of my kasama dito sa mga panel, dito sa press conference, ang mga pag-isip na umaga sa lahat ng ating daliga. Ng mga nasa YouTube, Facebook, Internet, all the bloggers, very sorry. When he appointed in July, na ako, hindi describe niya ang policy and the president will be starting out in the so we know number of consultation, number of audience, especially medication for medicine. So ito na yun. Result ko ko last January sa amin. Actually, second reminder. At una, pinag namin yung report action agenda. Kaya pinag namin paano how to begin yung individual. Kaya hindi ko na ito nung conference namin yun. The 20 urgent, bagong urgent year in ambulatory center. This is part of my program called the Department of Health Organization for Health and Wellbeing. Mga mayayaman, kaya pumunta din ng mga mahal ng hospital. Pinagawa equipment na, may operating microscope na, operating table na. So hindi ito yung political launch. This is a true launch from activity with services for our poorest Filipino people. I'm very proud of my staff that helped this, the Department of Health. Sa lahat ng tumulong, actually, yung story na itong pamilya nito, pondo ako ng pera for each fair. Tapos nung COVID, hindi sa lang ng COVID, sa COVID, sayang ko yung isipan ng local government na ibigay na lang, i-donate na lang sa Department of Health. And nagkakaon, meron akong plano. Facilities. So yung mga kakapal, ito na 25 bed facilities. 25 beds, pinagis namin yun, pinagisa namin modern laboratory. By inviting to look at it later, fully automated, pagdadagdagan pa namin. Because after this idea was launched, meron pa kami binang-break on another 200 million extension ito So doon na yung mga hindi ko kanina sa speech ko, yung mammography siguro, yung endoscopy, and all other facilities for the people of Pampanga. Di ba? Pwede pa ng trauma center, magkakaroon pala ng exit. Yan. So the people na karoon ka ng road crash, once again, pwede ba yung pasyente dito? Kaya sa kita pa sa napakalayo. So, ang dami ng potential, kailangan mo lang talaga bayaran. So, tumulong din na pinakita kami na napakaganda na yung pamahala tumutulong. At yun yung pagkakasyon, the full experience. Talagang bawat buhay mahalaga. Ayoko bigay mapapaalam. Naalala ko yung COVID. Sasalubong ako ng bakuna, kasama mo ngayon, mag-ibig. Kahit midnight. Siguro, nabanta mo niya, hanggang 2020, kasama mo pa rin kayo, nag-inaugurate ng mga facilities for primary. Minsan apat na buhay na ito.
Maraming salamat dito, Secretary Marbosa, for your opening remarks. Without further ado, I'll be now opening the door for the questions and answers forum. But before anything else, I would like to remind our friends from the media that advanced questions or submitted questions will be addressed first, followed by the live questions. For the first questions po, will be coming from Ms. Diana Canilao, the multimedia reporter of CLTV 36.
So, inasahan ko natin kasi hindi na ito ay sa dulo po nila hindi nagiging crowded ang GD DOH. So, gaano po ba maraming pasyente later din ako sa research natin? Gaano rin po marami yung staff or mga personnel ko na bibigyan sa dito? Kami na-expect na mga pasyente dito is from 150 to 200 patients a day. Bali mga report po ito na kapag ng JD guys. Ang ating po namang tao dito ay mag-duty mula alas 6 ng umaga hanggang 6 ng gabi. 90 live or physical present na healthcare personnel that will fund this for everyone's going to the city. So, ang gagawin natin operasyon, yung mga operasyon na hindi kailangan i-admit ang pasyente. So, tawag natin doon, ambulatory surgery procedures. At ito, meron tayong mga tawag na general surgery procedure, yung mga maliliit na things, be it sa tuto or sa balat, everything. So, pwede natin gawin yan. Reproductive health surgery o yung mga halimbawa, gusto kong magpatali, magpalengke ko, magpa-insert ng IUD, magpalagay po ng dito implant, gagawin mo natin yan dito. And then yung alternative methodology procedures, minsan po yung ating mga anak na maliliit, nakapagpasok ng kanilang mga minsan botol na kuhaan, na pwede po natin i-extract dito yan, hindi po kailangan yan ng pasyente natin. So, ophthalmology naman po yung mga katarakan. Pagkatapos natin ma-assessment, pwede po natin siya operahan dito. Day surgery lang po ang katarata. The region mo, yung pagkita sa mata, madaling po itong tanggalin, hindi mo lang po. Yun po mga, meron tayo tinatawag mga kulite, pwede natin yung administration ng drainage. Ayan po. At meron po mga ibang mga proseso na basta din mga elective surgery. Sa orthopedic naman po, yung mga ordinary po paglalagay ng halimbawa, may na-accidente po dyan, napaki ang buto, ikakasip po natin, stabilize, and then also simple cleaning procedure, yung tinatawag natin close reduction, pwede po natin gawin dito yan. For the dental surgery po, meron tayong ginagawang dental surgery, lalo yung mga impacted na mga wisdom tooth, kailangan po yung for the dentist, hindi po siya kailangan surgery. And of course, meron tayong tinatawag na mga pediatric surgical procedure, yung fully po sa mga bata, gagawin po natin yan. At magkakaroon po yung ng day surgery hernia procedure for children. At ito po ay isang gawin sa mga proseso pwede natin gawin. For other procedures like oral, maxillofacial, ambulatory surgery, minsan po meron tayong mga ginagawa. Yan pwede po natin ito po mga ginagawa or mga things pwede po natin yung or
and Ms. Diana Canilao. For the second, Mr. JC Posico.
Hello. To Dr. Monsen, good morning po. I'm Chief from TV5. Nabanggit po ni Sec. Canabo sa kanina na parang itong bukas facility also is to decongest yung mga regional hospitals natin. So ba yung situation sa JP as we speak? Nagmapuruan, go ahead.
Napakaganda ng iyong tanong. Itong pagtatayo natin ng bukas facility ay isa sa naging solusyon natin, ano? Para ang mga pasyente natin ay hindi masyadong pipila ng mahaba sa ating outpatient department. Currently, our outpatient department caters to around 800 to 1,000 patients on a regular day. Pag lundis po, expected po nyo yan 1.5 ang size or the volume of patients natin. So yung mga pasyente natin na nanggagaling sa casualty area natin around, hindi na rin kailangan para magpapagyung natin or mga specialties natin, at dito na rin po yun.
Pero in 800 to 1,000, pero lang ba yung kaya dapat?
5 hours, please. Ano, dahil alam mo, pag pumunta ang pasyente, malayo ang pinakagalingan, hindi naman natin sila pwede pagkagilan. So, kailangan talaga natin silang accommodate. Pero ang atin po sana OPD, accommodate around 700 based sa space requirement.
Second boss, say, before may mga nabanggit na data, hindi ko nagkamali yung mga namamatay sa banyo, yung mga hindi nakakapag-check up, paano ito makakatulong po sa kanila? Go ahead.
Definitely yung mga namamatay sa bahay, walang access, walang ng pamamaran para pagbating natin ang primary. Ito, hindi ko kaya yung dating primary healthcare, parang healthcare worker, tapos yung doktor, parang bigla. Ito, lagi ko may doktor. Sabi ko, yung Department of Family and Community Medicine na narinig yung pagpunta dito. So, lagi meron ditong family division sa pinagpapatuloy. Sigurado may titigil. Hindi lang yung tawagan tayo kung hindi niya isa na kung sa ano. So, yung surgical ako dito kapatuloy. So, bibigyan sa ating service yung magaganda.
Tapos last sector sa outbreak lang, yung kung binabakit niya rin before, na parang at least dito, yung hindi pa ganun kalala yung sakit ma-address na.
Yes, so pinaniwanan ko yun, ano? For cancer, for diabetes, for kidney disease, ulit tayo, natin. It's state obligation. That's not good public health practice. Good public health practice ay early detection ng cancer. Magawa natin dito. May ultrasound dito, dagdagan ko pa ng mammography, endoscopy, colposcopy, para ma-scope na yun, may colon cancer, yung breast, mammogram na, yung may cervical cancer, ma-colposcopy na, endoscopy, endoscopy ito. Iba siya sa pakasya, pero wala lang kaka. All the diagnostic, so what we have to do, maaga natin mag-diagnostic. Ang-hope ko na, sana, gumawa ng pila ng mga packages for yung products outpatient. Kasi nito mga ito, napapagpapila, pag-agpila sa hospital, napapagpapila nyo. Pag di pa ito yung outpatient, endoscopy, mammography, x-ray, napapagpapila ang gastos natin. Kasi hindi na ako dito mga doktor eh. So, benefit packages for outpatient tests, blood tests, readings, ultrasound, x-ray, magkano yung babayad doon? Kapag yung pula, si Vice Government Pineda na bahala.
Okay, Vice Governor Pineda, do you have anything to add?
Napakaganda dito ating focus center, no? Kasi sabi ng Mr. Tayo, laboratory surgical research center. Dito makakalitin ka rin yung tuberculosis, yung tawag kayo, yung pregnancy, itong test. Tapos sabi ko rin yun, yung breast cancer ng mga kapatalayan. Pag nagkakaroon mo na yung breast cancer, maliit ka pag ginagawa niyo yun, sigurado yun. Pero pag malaki na, sigurado na ma-request yung survey. Kasi yung mga babae ko sinilo, lahat ng mga kahit sa Kapitolyo, nakatang pumunta, kasi nabili ko ng ginagawa sa Kapitolyo, sa keyboard nila, press culture, sa service culture. So ito, pag na-detect mo, yung negative detection mo ng sakit, pag-ano mo, hindi siya magiging cancer. Pag parang ito yung preventive talaga ito ng ganito. Sabi nga ni hindi na ito yung parang ganito. Ang dapat natin gawin ng mga cancer. Dapat sa mga Pilipinas, meron ganito. Kasi yung mga Pilipino, naka-Pilipino ang Pilipino. Naka-Pilipino. Sa Pilipino, kung wala ka naman doktor, wala ka naman puro ng laboratory, wala ka naman diagnostic, sila na mga Pilipino ba, naka-Pilipino. Kaya pa rin yung hindi niya talaga may yung balas na yung sa healthcare. Kasi walang matutulungan ang mga PhilHealth member. So, si Secretary ng Department of Health, ilalagay niya sa mga mananapit na pangyayari na kasi nila magpasana para maging masila sa Pilipinang Secretary sa pagbubukas sa itong bukas.
Maraming salamat po, Vice Governor Lilia Secretary Bota and Dr. Choco. Next question will be coming from Mr. Rafael Bosano of ABS News.
Ito po ay yung other than chili. Sa parents natin na hindi naman ginagamit ay pwedeng which para mas mapabilis yung pagkakaroon ng mga actually, yung original idea ko in January in the National Health Care to the state universities and colleges na nag-open ng medical school. So para walang ito din nangyari. Muna sa akin ng yung lang, kuligtad. Tapos sinabi niya, magkaka-medical school. So, walang problema sa personnel. State University, parang ganito pa. Yung usan mo, ng State University na nakalimutan. Okay na namin si Chairman Popo di Vero. Function ang FCC. So, si Yusek Barrero, yung presidente ng Benguet State University para hindi na siya. Kung State University para sa gitna teaching hospital, maybe 100 people. So, dumami ang graduate natin na doctor, nurse, dito sa mga SPC, scholar ng bayan sila, scholar para sa bayan. Dadaan rin ang ating mga doktor, mawawala naman ito. Other problem, yung manpower problem. Pinag-usapan natin, pumubuha pa secretary, diba? Saan na pumubuha tayo nurse? Kasi yun naman, karoon sila ng maraming hospitals. So I'm very happy with the announcement of Congressman Ana York that there will be a medical school 5 minutes away. So dito na yung medical machine na mga dito na yung tatapos at bibigyan ng mga outpatient. They will learn outpatient care in this facility. And then they can rotate in JBL for in-hospital care during internship. So alis na tayo, dadami ng doktor, dadami ng personnel. So, last time, ng ibang foreign investors, they were partnering with the PNP. Pagkaganda nila yung healthcare ng PNP. So, actually, ganun yung Amerika. Kasi yung ginawa naman mo, hindi siya. Kasi ako, sa one idea, go ahead. So, when I started going to the chief of staff, Surgeon General, chief of staff, sabi, Kaya ako mag-sponsor ng civilian personnel in secure military tasks. Lalo na in conflict zones, baka papakasigan ng sa iba. Hindi yan nila. So, naging security and security. Pero ngayon, na-realize ko, yung coast guard, hindi yan pala yun. So, pwede naman mag-review ng ganito with the PNP. At tulad ng gagawin natin na panahon, yung kapanong yung hospital din. So, I can help modernize that with DOH money to the help of Congress. Usage and of course, para lahat ng police and their dependents magkaroon ng primary care. Bilang din sa Coast Guard, yung Coast Guard natin Navy, may health care sila kung Navy nila. Kung Coast Guard, may so I'm building the first hospital sa Pilipinas. So, development sa universal health care. In infrastructure for the hospital care facilities of both in the private and the public sector. So I'm very glad the presidency of the Marcos really serious with this. Dalawang wala na, hindi na sinasabi niya, 179 special centers. Of course, hindi pa nasabi ko. Pero pinitso niya sa akin to as an order, we need to point to the picture. Bakit ito sa Singapore? Because we try to get it done in other countries that is improving health. Singapore, Vietnam, Indonesia, Thailand, and more other outpatient facilities. Not only that, they have improved the organization. So people who have good health safety.
Nabanggit po ni Secretary of the Wonderful Vision, ano po, nabanggit niyo po yung PNP. FYI, everyone knows the man of compound. We're only 10 minutes, 5 minutes from Camp Palibas. So we can actually sign po our wall with them. Para dito po, dito na po sila. You will sign na kami. Doktora, mag-sign po tayo. Meron na po ng MOA with PNP. Before po na kay Secretary. Before we even stay here, nangyari na po. So, we will also be coordinating with the PNP. For everyone's information, ako po magtatayo naman po ng Coast Guard office dito po sa San Simon, which is also another 10 minutes from here. So, pwede rin po tayo mag-coordinate with the Coast Guard. Ako. Kausap ko lang po si Coast Guard kahapon. So, said, meron na po rin tayo. Dito ang with the Coast Guard. And, kasi yung office nila, provincial office nila is only dyan po sa San Simon, which is like 5 to 10 minutes, depending on the traffic. So, mangyayari na po yung vision nyo, stand with it.
Next question, Sir Ravi, do you have any more?
Sure, gagawin nyo naman po. Since nasa central is yung tires, was very how are the hospitals prepared for the possibility of water shortage? As nangyari po yung 2019
Correct. I'm glad you mentioned that President Bono actually appointed the Secretary General as the chair of the National Task Force El Nino. And ako nag-create na rin ako ng Department of Health Task Force of El Nino. Ang lahat ng hospital director actually hiningat ko na ng El Nino preparedness plan. And supply water and electricity. So in fact, ang konsepto namin, pinakausap na ng mga hospital directors, ang mga supplier ng genset para maglulenta na lang kami. Kasi nag-simula ninyo, so rental na lang ang payment agreement. Tapos yung water, making sure na meron tayong water supply. Now, how can function without water? Wala kang sterilization, wala kang surgery, wala kang laboratory. So running water is a very important problem for hospitals. Ang nangyari ang ninyo, because ang ninyo, you tap down water to the irrigation, water supply to the households, pero hindi ko kung ika-cut down ang water supply sa households. So meron ng team ko yan, baka ito ko explain some more.
Yes, in our hospital, nagtayo kami ng mga water systems. Pinupuno namin talaga ito. And it is capable of maintaining our operation. Example, tayo ng supply ng tubig from the local, can maintain it for 5 days. And then we also have deep well pumps. Tatlo po yung malalaking deep well natin na pwede natin gawing source ng water at sa tubig. Ang pangatlo po, meron kaming connection with the local water district para tuloy-tuloy po ang ating supply ng tubig. In terms of power naman, kasi alam natin pagka El Nino, nagkakaroon sila ng power. We have standby generating sources, kakaroon patakbuhin po yung hospital. We have 700 kVA na generating sets po, po yun. And this facility only has a 500 kVA generator set that will ensure that yung kanyang operation ay hindi mapuputol kahit na tayo po ay nag-opera. So ito po yung mga magahan na kailangan natin. And in the future po, meron kami solar power and also
infrastructure preparedness. But when it comes to that, ngayon pa lang ang init na, di ba? So I'm inviting all the hospitals, especially emergency medicine doctors, to start training our people on how to treat heat-related illnesses. Yung because of illnesses, yung mga hinihimatay, which are very common to the very old and very young. So very important, yung heat exposure, pati mga then the dehydration, option, heat stroke, you can die from a heat stroke. Most people can die from a heat stroke. Kung may hypertension ka, pwede bumagsak yung bleeding mo. Hindi ka na rin, pag may heat wave, ang dami mo na talagang namamatay. So dito, kailangan mag-prepare na tayo. Make sure na mag-educate yung mga tao. I hope na we can talk a little bit about people living with it. Another illness that will come out is what we call waterborne illnesses. Kasi pag hindi yung COVID, yung fire distribution of any LGU, pinapasok ng 50 page of colon, bacteria, cholera, at mataas din ang outbreak ng waterborne illnesses. So very important to remind people that, filter water, to boil water, to probably make sure, lalo na kung kita na yung tubig, open ground, yung microbes, E. coli, fecal bacteria. So dyan magkakaroon ng sakit, makabakit. The third, of course, is vector-borne illness. This is known that when the temperature goes up, siguro, hindi din yung mga mosquito, nag-multiply sila. And it's also because nagiging po ng iba, because walang tubig, hindi po ng iba. So may mamapan ng natin. Pero kapag baka magiging ninyo, dumami na mo. Pag dumami na mo, dadaan na naman yung yung magiging ko ng tubig, para hindi namin yung lugar na people. Ito ang mga reminder.
So, tanong naman ng mga Dr. Gano'n ka lang yung-impact po yung nakikita niyo of business having jobs?
Ang atin naman kasi facility is meron kaming identified catchment. And because there is already ongoing na mga infrastructure loans, so nakikita namin na ang aspect ng facility that ito ay was madali. So itong ating mga catchment areas ng mga tao na out activity, ay mas pumunta sila dito rather than going to jail legal. Ang aming pasyente ay maabot po ang galing sa Bulacan, from the town. From the north po, meron po kami galing ng Tarlac, from the east, from the west po, ang Bulacan. So nakikita namin po na ito ay magiging kabawasan doon sa loob ng pag-ibig namin. It will be near the access to specialized healthcare will be there. Yung people na nandito po sa agriculture area. So mas makapadali po ako po kanila. Nakikita ko po sa amin, dala-dala po sila ng mga patient health and details po na padala ng mga pilang barangay, mga munisipyo, para nakabilang po sila doon sa hindi ko po, mas madali na lang po ang ating dispatcher para makikita sa ating mga patient.
Maraming salamat po sa ating mga panelists, Mr. Roman Rosano. We are down to the last 3 questions. And the third to the last question will be coming from Ms. Buena Bernal of Channel News Station.
Secretary, I just want to request this to be a full English soundbite. So, ambulatory services and professional fees for surgery do not comprise majority of Filipinos. Medicines do, and even if we can diagnose them here, if they cannot afford the medicine, then we don't close the loop for patient-centeredness. So just to close the loop for us, how big of a problem is medicine cost in the Philippines? What is the best way to lower prices?
That's a very good question, but that's a question within the cabinet we're trying to answer also with the help of the president. The president wanted to actually know how we can lower the price of medicine. For the poor, we will provide the free medicine for HIV, for the common disease, hypertension, and that will be free. And that will be free in this facility. They're also thinking of a new package, it's called the Vermont package. They will pay for chronic, all these chronic illnesses. So all Philhealth members will have some limit the part of the cost. Like me, I'm hypertensive and pre-diabetic. I'm taking in some drugs. It's almost 5,000. When I think for an ordinary worker, 5,000. But just for maintenance spend. So you're right, that's a problem once again. One of the things I told the president, we need to bring pharma home. The only way I can lower medicine is to produce them here. Because we're importing all our medicine from other countries with multinational. So my idea to him, and he picked it up, to create pharma zones, manufacturing of the medicines. Our own companies, I think the Bibla, yung manufacturing in Vietnam and Indonesia, kung sila yung impact, so how can I attract foreigners? Ilalagay natin na ng regulatory functions, yung DOH, all the benefits of federal zone. So, hindi ka nagawa ko computer, nagawa tayo ng pharma zone, with all the pwede mo nakakasama yung ibang ingredients and then we put it there and then have a final product and then export that to other parts. So I really want to be Secretary President in economic budget. So if there are Singaporeans interested to build the facilities here, it's about the time the president wants to invest in the healthcare. And ang daming gagamit, to pay for it, and we can lower the
Secretary, ASEAN-wide, there's a conversation on how to prepare for the next possible pandemic. And in the Philippines, we're still trying to attain basic indicators of health. So can you just close the knowledge gap for us? How will you help prepare the Philippines for the next possible pandemic?
Okay, so don't say that in the meeting we're only trying to close it up. No, I'm actually in discussions in the UN for vaccine facilities in ASEAN. So they want to do vaccine production in the Philippines and the pharmaceutical idea, where each country in Asia will do vaccine. And then we can convert to vaccine production and mRNA when there is a disease X. So we're going as far as that and going in regional and global with discussions in healthcare. But you're right, no, very important. For anything I think is one of the vaccines TB. The reason I don't think now is not only X-ray, it's the molecular test. It's the same test we did for COVID PCR expert. Now we can detect it with Q2, we put it in the gene expert 4 hours. I already know here it's more accurate than the acid pass that we like. The old test we look at the one. But it's not there. So the picking up the tama this is what I'm doing. The correct thing, definitely, are actually part of that. Actually, I am also building about 250, but it's a world backload. But world backload funding also facilities like this that will be funded in the area for rural area. There's about 250 that we can identify. I'm just waiting for the next world backload. You can solve the pair of this program. I converted it to primary care project.
So that you mentioned that we're still attaining basic health care And what are we going to do for the next pandemic? I'd like to just say, some other first world countries like the US, ang dami rin naman kayo doon. It's more than 1 million. And yung given how many more billions na namatay. Dito po sa Pilipinas, 60,000. So I do not think we can correlate between closing whatever gap. Maraming gap po sa pag-iisip ng tao. That is a very difficult gap to close. I'm very proud of the Philippines and Secretary Bosa was one of those in the forefront along with Mr. Verdera and the rest of the DOH team. Sabi nga ko savings, pinupuntahan nito kayo ng buong Pilipinas. And you saved the Philippines during such a difficult time. So maraming salamat po.
And the health report that we were outbreaks, we were able to vaccinate 74 million people. That's 7 times the population. And we had the fourth highest vaccination in 1 day for COVID. So when you ask me, can I do 95% of children fully immunized? Of course, because I was able to do it during the COVID. What can I do for so many children? So we need to do 95% of 2 million very doable.
In relation to funding, Secretary, how do we then expand the funding sources for Philippine healthcare?
I was in discussion in Brazil with the Minister of Health of Indonesia, and he was bragging to me. I invited him coming week because he's a backer and then he's member of parliament to be Minister of Health. And he got so much money to build back this department. So for one, I'll teach you how to get money to what money for healthcare in Indonesia. They're building like molecular lab, gene expert. I was proud with 1,000. 30,000 over the detecting master. So the key is really getting investments in health. So I think when we say I'm already the third highest budget, education, public works, and health. I think I should by public and DPWH is fine. DPWH is public-private partnership. Government, we need to invest tax money on human capital. But when you spend for health, investing on the Philippines. So we ask for more money, more tax. The private sector knows how to help government now. We learned that during COVID. The private sector helped us a lot. Now, there's a private sector advisory council for the president. They will see every time before they go to the president, they'll run to present what they will present to the president. So I think that partnership will continue. We will get more money from the private sector, from international backers. And I don't know, backers are interested. They don't want one thing they want Filipino nurses. They're willing to invest in it, but they're asking me for Filipino nurses. That's not a problem. I can send you all the best nurses, but invest in the Philippines.
Thank you very much to our dear go ahead.
We are actually having one of the best Korean loans infrastructure. Where almost 7 billion. But when I talk to the Korean bankers, it's actually the Korean Exim Bank. One of the things they urge us to do is to borrow for healthcare. So since I was familiar with the loan process, I plan to facilitate under one of their healthcare loans so that we can buy modern equipment and everything else that we will need. So the Koreans are getting willing to invest money.
I have good news for you. This came from South Korea. I'm getting a grant, not a loan, grant for my TV program. They're going to give me devices similar to gene expert, but it's Korean made. So there's a facility not no longer going up. The government support of Korea just like their foreign grant support, yeah, and but the one talking to me is not going up. So this is your finance. So what they do is they invest on Korean innovation and they don't go on and divide the gene expert. And they're going to buy from them and give it to us. And we get a very new one. And the Korean government is actually coming here, they have top TV, and I will announce that to them. when they actually announced that donation. For sabi nga, the grant of South Korea is a lot. They want us to go to them. Hindi na po po na. For sila handle on the grant. They want them to the ministry. They're the ones giving us funds. So grant will be a lot too much. So, and then they're not giving so much the Koreans because we sent them soldiers if they were at one. They continue to remember and celebrate. I'm expecting that Korean grants for help.
Again, thank you to our panelists and big support of our knowledge. We are down to the second to the last question. Second to the last question will be coming from Ms. Louise Rital of GMA News. Of course, Secretary, sir, can I sir, I just have a questions. Dapat bakit po natin sa kapag kung sa ating first umat facility, binigyan ng mga law, usually para sa mga spend funds, but unfortunately, we haven't get it because of what and my second question is, ano po yung viewers for certificate na student grant po, hindi pa yung value po ng disposable waste.
First question, hindi mo pinili ng Pampanga. Pampanga pinili sa Pampanga came to me and said, we're ready, we're inaugurating your idea. So they came to me, the authority of governor and congresswoman. Sila ang lumapit sa akin, hindi naman. So, na-convert namin from a community hospital to a Bukas Center. The 52, by the way, are not different. 52 are the same things. They are operating as my hospital director to build me Bukas Center. Hindi siya request. For yun, meron na sila ng pump, meron na sila ng facility. Yung isa, June, sabi niya, June. Yung isa, next month. So, sunod-sunod na ito. I think the hospital director is not my hindi yung great fit. They're the one from 20 and 52 months volunteer. So I stop. But we do that. The next step, therefore, to make them functional and then make them connect with the primary care facilities of the HB. So nagkakaroon yung ginagawa ko. Nagpo-connect din lang ako ng DOH, the regional hospital, the center, the and then the primary health care facility. And then we'll have what's called healthcare advisory network, which is stated in the universe of healthcare. So big is really a big problem, and I'm glad the Secretary Recto said something about planning. Singapore planned with really their new the big stage. So I don't know, in the Philippines we passed a law that Doctor was one of those that actually made sure that BPI approved the bill, and we make sure that FDA will still register what you inhale. What you put, that's a law. What you put in your mouth and what you inhale should pass through FDA for safety. So, you know, very important now. It's now a health concern. In fact, my meeting after this today, good morning, I'm going to meron na akong expert because I'm teaching if I'm making. Sabi niya, parang ako nakakagit sa atin and provide the all expert. Ano ba kung usapan namin? Hey, why am I talking to you? I have no police powers. I'm going around the mall. It's in high school uniform. It's high school uniform. It's in a school bus. They have a shopping. And the new thing, from 21 to 18. So I'm going to talk to PNP Chief of Ordnance. Most people, wala pa akong kapasidad ng bigay. Pero we will ask your help. You know, next meeting room. I will ask his help to implement the law. He will implement the law. 18 years old. What's the problem? So the way companies are taking it, you know, Sabi ko, hindi ko yung bata ang nilili natin. Hindi ko yung benta dun sa bata. The one that told the children, you don't thinking about you. Hindi pa ang pera ng part ng finance para tulungan niya sa vehicle.
Thank you very much, Secretary Herbota, and leave the minister down. And for our question will be coming from Ms. Carmen Estrada of Environment. Please go ahead.
First of all, sumingin. Actually, for the last question. And this is, we would like to proceed in PhilHealth. 1.4 million po na nalagdag for breast cancer treatment. But my question for Sir Walter, who is here today, sa mga po, benefits. Pero again, sa mga late stages po ito, bakit hindi po kino-cover ng PhilHealth ang mammogram? Speaker from office already came out with this, and I think posted it po sa akin na dapat ganito po. Speaker's office yesterday, nasa Australia po, sa with President. So I was waiting for him, at pinalaunch po namin yung po. PhilHealth should cover for mammogram. Bakit po ba yung pinagawa PhilHealth yung mammogram?
We're preparing for the sport bowl. We will launch po ang good news po sa Bigla. Aside from we have increased all benefits with a few exemptions by 30% because of Congress and LGU like economy. And number two po, I would like also to spread that we have also adjusted the benefits of Bigla. Breast cancer po.
Yung sa mammogram, it's within this month na yun. We can cure breast cancer of stage 1 and stage 2. Even in stage 3, but we need a mammogram. So pinapayaran ko pa yung mammogram.
For you because it is within this month. And nakita namin sa second number 2 cost of breast cancer for women. The good news po is we are increasing the payment benefit from 100,000 to 1.4 million pesos.
Thank you. Kasama na po ba din ang mammogram?
Patient check up po yung digital po natin telling our DDRD to speak on the benefits.
Maganda po. So we are joining this meeting. But I would like to, Secretary has mentioned this. Huli na po tayo pag kinakapagay. Okay, we need to pay for the mammogram. So the mammogram, you go on the treatment. Actually, we can save money. Kasi yung mga ng mga gamot, sa huli na yun. Pero kung magkakaroon na pa, ma-cure na po natin, hindi na po tayo pumunta sa huli. Kumbaga. So we could save money kasi ang volume naman po si mammogram, nag-bukura din po. So yun po. Can I join this meeting? 1.4 million must include the item of coverage po, which is 35 for families and 42 for everybody.
And I'd like to officially state that I support the fourth speaker, Martin Nuwale, for to pay 50% of the private healthcare. So if you do that, we support the report value. So I actually support that. If they want to increase everything, I support the fact that I support that. I think 10 to 20%. So we need to increase that. And I concur with the 50% of the pay.
Thank you very much, Secretary Herbota. To Mr. Walter. For the last question, we'll be coming from Ms. Carmen Estrada of Environment.
Sorry, last question na po ito. Secretary, so it will be 28, 52 by 28. Oh, okay.
Because I think
More than 52 pa.
more than 28 or 28, ito kasi 28 bukas sellers, 28 million pulis. Kung ano madami yung pulis,
52 bukas.
ano tao, 28 rin ang Jogo. Pero mukhang ang ma-achieve ko, more than magagawin. Kasi hindi lang nakapag. Kung ba pag-uwi ko 28,
Sir, ano ba ito?
actually, pero wala akong bilis kumalong ito. So, actually, ginagawa ko pag-develop Bureau, yung posting nito. Actually, I haven't received it from my team. So, kompleto yun. May mammogram, may big expert. I'm actually asking the boss. Actually, bigger than this at the board compared to an book center. So, parang isang health center, it's more into large. Kasi may small na parang super health center na. So, yung medium ganito. Ano mo mga yung large ko? Ito na yung PGH OPD. Yung PGH OPD corridor. Yung conference ng sa taas. Kompleto ng lahat ng diagnostic. So, ito yung isip ko. Minsan, kung I can build that also.
Yung budget from the national government allotted for this particular device. But I don't really
Health facilities. You can spend something like 30 to 40 billion. So, kung tayo yun, hindi naman nagpapakita yung allocation natin. It's only to where I will put it. Dati barangay health station siya. So, parang kesa magtulungan ng isang barangay health center. Tayo yung mga 30 to 50 million. Kung health center, ito rin 30 to 50 million. Bakit dito may maglagay ng lock tower, lagyan yun. So about 50 million to the large per day.
Sir, libre ba pagpapagamot ng mga nasa komunidad po? Libre? Libre po ito para pagbayaran.
Plano ko dito, sustainable. So, important, indulgent, no matter billion. Kaya yung hospital, no matter hospital, hindi nagbilang kung pinamati dito. I hope yung mga doktor dito, mas daw bilang private practice. Pwede rin sila tumingin after of the hours, or kung hindi sila duty, sila naman yung tumingin ng private patient nila dito. And very good. And then, doon na gusto magbayan, hindi naman kami nakakita sa bayan niyo. Hindi sila magbayan.
For the rest of 27, we leader municipality also for municipality. What is the next thing or the job?
The group is mandated for the 28th, and actually the SMC will medical report. That's the only thing. But I'm not stopping any regional director or hospital director to build it on land given by local government, land given by PNP, land given by anyone. Everything. If there will be that, if they want a health facility, we will build it. At kung hektarya ba itong binigay sa akin, at tayo ang magandang health facility, ang mag-benefit yung people of Santo Tomas and Trinidad.
All right, that sums up our Q&A portion. But as we end our media portal, may I ask our dear candidates for your parting messages, starting with Dr. Chitrogo.
So, pagkati na po mensahe sa ating mga kababayan, lalo sa Santo Tomas. Ang karating na bayan natin, laminarin at ang San Simon. Yes, sir. So, andito na po ang bukas facility. Ito po ay bukas palagi sa inyong pangangailangan. Ayan, hindi na po tayo mag-ooperate ng 24 hours, but we ensure that all your urgent needs would be met. Maisisilbi po natin yan from 6 a.m. po hanggang 10 p.m. may tao po ang ating bukas facility. So ang mga nanay po na magdadala pa ng anak bago pumasok, alas 6 ng umaga po, bukas na po tayo. Kung galing po kayo sa trabaho, kailangan po nyo galing ng mga anak ninyo. After office hours, ang alas 10 ng gabi po. At serious po yan, kung ang pasyente po natin na natignan ay kailangan naman po ma-admit, meron po kayo ambulansya at meron pong doktor na kasama yan. Kailangan din po kayo kung saan po tayong pasilidad. Kailangan pa-admit ang ating pasyente. So mula sa ibaba, sa rural health centers, papunta sa bukas, at papunta po sa ospital, yung journey po ng pasyente natin, sisiguraduhin natin na mamimit po natin ang kanyang pangangailangang medikal. Maraming salamat po.
Maraming salamat po. Congresswoman Ana, you are going to start with.
Thank you so much po. My message po is, hindi lang po ito nangyari ng isang araw. It was started by 2 persons in 2017. So, my message is, if you build it, they will come and they will help you. But somebody has got to start. Somebody has got to start the day. And pag nakikisahan niyo po yan, maraming pong tutulong sa inyo. Lalo na po maganda po inyong lalawin. So I'd like to give heartfelt thanks. First of all, to President BBM. Kasi po kung wala po ito, would not have happened. To the DOH family for taking up this hospital and making it into the first hospitality. And to all of everyone from JBL and the Dr. Chichopo. And maraming salamat naman kasi wala naman magpapayag ng So it starts really with a dream and then just doing it. Move forward, marami kong tutulong sa inyo. Sa tulong po ng Panginoon, we are here today. Salamat po.
Salamat po. At General Vice President Interwalter Pereza.
And Chairman of the Board, just launched last end of January, bagong Pilipina. Kala nyo mga speech lang yun. Ito na yun. Bagong urgent care and ambulatory president. We want the people who are in President Bongbong Marcos to make the people feel healthcare. So ito yun. This is the concretization of the bagong Pilipina people. So kung tayo, what should we do for the Philippines? Ito ang ginagawa namin in part of the feel health. No one representative. No government will sana itong materialism na ito mangyari sa lahat ng region sa Pilipinas kasi natutunghayan ko na ang Pilipinas.
Muli, maraming salamat po sa ating mga panelists at sa lahat ng dumalo sa ating pagbubukas ng kauna-kaunang pagbubukas Senator sa bansa. Dito po yan sa Jose Memorial General Hospital.